And I will call the meeting of the Committee of the Whole to order. Meeting has been noticed in the Evans Print Media Group, WCOW Radio, Magnum Radio, La Crosse Tribune, Sparta City Hall, and the Sparta Free Library. Are there any changes to the agenda?
No.
I'll ask for a motion to adopt the agenda.
So moved.
So moved.
We have a motion from Mr. Lukasik, a second from Ms. Presswood to adopt the agenda as presented. All those in favor signify by saying aye.
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 Opposed? Motion carries 7-0. Item A, COVID discussion and update. There is no action being taken by the board on this item tonight. Dr. Van Duren.
And I will turn it over to Ms. Cooley for the first part of the presentation.
Good evening, everyone. So just to walk through what I'm going to discuss with you tonight is the first thing is just looking at our local and district COVID conditions, what the changes in the guidance are, our procedures that we're looking at for our mitigation strategies, as well as how we'll continue to monitor our conditions and internal data review. So the first thing I just want to point out, when you're seeing Monroe County Health Department's updates as far as what we're seeing with COVID conditions, you previously have seen the Harvard model, which used the green, yellow, orange, red, and you would see a number that was typically lower. So you were looking at the daily case rate. They have now switched to the CDC model, which is looking at the 7-day. So you're going to see a difference in their numbers. And I just wanted to make sure everybody was aware of why that difference was happening. I know that they explained it, but I just want to make sure that everybody is aware of that change. So they'll no longer be reporting on that Harvard model. Instead, they'll be using the CDC model. So the first thing I just want to look at is you will see the COVID update from Monroe County Health Department. So you'll see a couple different things, the total cases per 100,000 in the past 7 days. So that again is why that number is bigger. So last week it was 28.11, this week it's 75.67. So the cases are increasing, but the number's even bigger because they're looking at that 7-day. Additional thing to take a look at is because of that 75, we're in the substantial transmission. So that orange group per CDC guidance. And our trajectory is continuing to go up. So what I did is then compare that to our school district data. So you look at the same date range, we had 3 positive cases and 6 quarantines. Since that update, and again, the health department does that on Wednesdays. So since that update, we've had an additional 3 cases and additional 15 quarantines. So that's just giving you kind of a comparison of the things that myself and Ms. Frost, our district nurse, take a look at, as well as the rest of the admin team on a weekly basis. Next slide, please. Another question was around the Delta variant. So this is all information from DHS, or the Department of Health Services. So last week on Thursday, they put on a webinar for district administrators and school staff to attend to look at what are we seeing with the Delta variant, as well as to explain their guidance further. So what they know about the Delta variant at this time is it's 200% more transmittable, which means they're comparing it to the spread of chickenpox. Additionally, it has 1,000 more viral load than the original. So that's how much the virus is present in the body. 80% of the cases are being considered the Delta variant. Now, when you get a COVID test, you're not going to know right then and there whether you have the Delta variant or not. You'll know if you're positive, and then they send it off to determine if it is the variant or not. Additionally, DHS shared that we're looking at the beginning of the Delta wave. And what that means is they've seen 10 times more of an increase in cases over the last 5 weeks. They are anticipating that they'll be in the red, or that high transmission level, in every Wisconsin county by the start of school. Again, this is their prediction based on the data they have. Additionally, they discussed about how they're preparing hospitalizations right now. So they're opening, and Gunderson just did this as well, they're beginning to open up those COVID wards or wings within the hospitals. And they're also game planning. So when we have additional COVID cases, how are they going to treat the triage? So a car accident comes in, how is the hospital prepared to handle the triage if they're at capacity with COVID cases? So those are all the updates when I was on with DHS that they had shared with the local districts that we're on. And just as a refresher, when it comes to guidance, CDC, or the Center of Disease Control and Prevention, always puts out that first guidance. So they put their guidance out, And then what happens is the Department of Health Services, so Wisconsin's Department of Health Services, or DHS, looks at that CDC guidance and they interpret it and then they put out guidance. Department of Public Instruction, or DPI, also does the same thing. And then all of that feeds to Monroe County Health Department. Monroe County Health Department has made it clear that they will follow CDC guidance and DHS and DPI guidance, and they're all very much in alignment. So that's just a reminder of how the guidance comes into us as districts. Something that rang true when I looked at all of the guidance from CDC to DHS to DPI in our health department, all of the goal with all of the guidance is to keep our students in building. So that was read through and through to me when I was looking at the guidance. They want our students to stay in building. So a couple of the changes that I wanted to highlight for you. A key one is when it comes to contact tracing. So a lot of the guidance has stayed the same from the beginning of the pandemic to now with some word changes, but this new guidance has some pretty significant changes that we haven't seen in the past. And primarily when it goes back to wanting students to stay in school, this is a big piece of guidance that changed to support that. So what they're saying is when we're looking at student contacts and mask wearing, so that there's that consistency of mask wearing within the classroom, students that are within 3 feet will not need to quarantine. So that is a big change for us. Previously, they said students 6 feet. They have now since made that smaller to that 3 feet. So if students are masked and 3 feet apart, then we don't have to quarantine those individuals. And again, that has stayed the same for adults. Anybody else 6 feet or more, we don't need to quarantine. So that is a change that they had made in the guidance. Next slide, please. The next piece that is new to the guidance this year is, again, and I'll take you to that third bullet for me. Basically what it's saying when it comes to classroom arrangement, if students are moving freely throughout the classroom without maintaining that 3-foot distancing and interacting with the teachers, when there's not that universal masking, the entire classroom would be considered close contacts. So instead of a couple, they are now saying that classroom would be considered a close contact. So to summarize all of those changes, 6 feet distancing, no close contacts. If there's universal masking with 3 feet distancing, then students would not be considered close contacts. If there's no universal masking and students are moving freely in the classroom, then all students and staff would be considered close contacts within that classroom. Additional change that happened was for fully vaccinated close contacts. So previously it was if you're fully vaccinated and you're close contact, as long as you don't have symptoms, then there is no need to quarantine and to continue on, but we ask them to continue to monitor for symptoms. The new guidance is stating that if you're close contact and vaccinated, that they're saying you need to mask up. They're highly recommending testing after day 3 or 5 of exposure. But the key with that is our students can continue to be in building while waiting tests if they're masked. So previously, if somebody was getting a COVID test, they would immediately isolate till we received those tests. So they're making that exception when it comes to the vaccinated. Again, any positive test, they're always saying isolation. If in a negative test, they can continue in building and remove the mask as long as there's not a mask requirement. So anybody that's vaccinated, if they develop symptoms, it would result in a quarantine for the remainder of the 14 days. So those are the changes when it comes to fully vaccinated close contacts. And just a reminder, I think this is very important for everybody to know that the Sparta School District, we do not issue the quarantine and isolation orders. We do support Monroe County Health Department in that contact tracing, but all of those isolation and quarantine orders come through the health department, which is where we follow all of those orders because they are coming from that health department. So the health department has the right to do that. So we as a district follow that, and the statutes are linked there around that. So now when we're looking into mitigation for the 21-22 school year, here are the things that the admin team is looking at as far as mitigation. As a reminder, masking will not change without board approval. So as an administrative team, we will not say masks are required. That is a board decision. So the board makes that decision on masking. What we will continue to do is our strong air filtration systems in all buildings. We will continue to practice proper hand hygiene. So in from the playgrounds, at sanitation, washing hands with soap and water within classrooms. Sanitizing and disinfecting on a daily basis. We have a phenomenal custodial staff that's making sure that they are doing their due diligence within our classrooms. Requiring masks on transportation, again, that's that federal order of masking on transportation unless there's ADA, disability, or medical reason not to. Use of outdoor learning spaces. We have beautiful grounds, so encouraging our staff when there's opportunities to be outside, take your class outside, take that learning outside. Limiting of materials and supplies. So with sharing materials and supplies, in the classrooms, we're doing our best to mitigate that sharing of items such as pencils, crayons, what have you. We're going to continue to have students have individual as much as possible. Having those water bottle fillers for our water fountains. Keeping our students grouped as much as possible. And again, that goes back to that contact tracing. If we can keep our students in that same cohorted group together, when I'm saying cohorted, I mean that group through the school, that's really what's going to help with that mitigation. Assigned seating in all classrooms. So if we happen to need to contact trace, we'll have that assigned seating to help support Monroe County Health Department through that process. And again, our robust contact tracing. We do everything in our power to notify families as quickly as possible to ensure that they're able to plan when we know that that Monroe County Health Department isolation or quarantine order is coming. Our changes for the school year, so things that we did last year that you're not going to see as much in our schools this year, is again, that masking is optional, again, required on transportation. You're going to see students moving to different classrooms and common spaces throughout the building. So we did our best to limit that last year. This year, you will see students moving more freely. Students will be moving freely within the classroom. So that carpet time, the small group times within the classroom, we'll be seeing that. There will be sharing of supplies, especially in the electives. So when you're thinking of music, art, PE, tech ed, equipment and materials will be shared amongst students. Our common spaces, such as the cafeterias and playgrounds, will be used as they always have. And then, like I said before, that small group instruction occurring within the classrooms. So what are we doing in an ever-changing world of COVID? We're working really hard as a district to monitor not only our district data, but as well as the county data, looking at the COVID conditions. We continue to review data trends in the district, working very collaboratively with Monroe County Health Department and other local districts to ensure that we're doing what's best for our students to the maximum extent possible, and preparing to increase mitigation measures if needed. Any questions for me? And I know Dr. Van Duren has additional to add after that, but I wanted to see if anybody has questions for me first.
Mr. Lukasik, go ahead.
So for continuity purposes, we started out with the terminology COVID-19 and we moved to Delta. The charts that are given from the Health Department and CDC and everything like that, are we using both of them? Is the terminology the same for at COVID, or is there a separate process that we're going to go follow that's for Delta variant?
That's a great question. So essentially, it's all under that COVID umbrella. Now we're just seeing strands. So that's very typical with any virus. And I'm not a health expert, but this is just from my research that I have done. It starts one way and then it branches, the variants branch off based on how it's spreading. So all of the guidance is still under that big COVID umbrella. However, right now, since we're seeing 80% of those cases being that Delta variant, they're adjusting some of their guidance and protocols based on what we're seeing there, because that's the most prevalent one that we're handling right now. But they'll continue to be different variants, which is why it's under the overarching umbrella of COVID.
So when you say overarching, the mitigation that we're talking about is the same no matter what variant, what name you give it, it's going to be the same mediation.
Correct, absolutely.
Okay, thank you.
You bet.
Any other questions from board members? Mr. Burns Gilbert?
Quick question of so masks are still required for transportation, right? Does that include, I know earlier we were going to budget for more transportation. Does that include like traveling to athletics and travel, like all of those are
Yes.
lumped in there? Okay.
Correct.
And then you answered my question of who's doing the quarantines, health department. The cohort piece at the end with the contact tracing, is that still going to be happening for sure, right?
Yes, and when I say cohorting, it's not what we're considering cohorting, where some students come some days and some students come on the other days. When we're talking about cohorting, we're trying to keep the same students together as much as we can. It's not a guarantee, but the more we can do that, if there is a case, the more we can track the spread of it, if that makes sense.
Yeah, that's more like the individual classroom groups
Correct.
staying together versus okay.
Yes, exactly. Yep.
Thank you.
Any further questions from board members?
Are we gonna talk about this or?
Well, I was gonna have Dr. Van Deren probably talk next and then
Yeah,
go
that'll,
more.
that'll work.
If there's any more questions from Ms. Cooley, otherwise I'll let her go.
Thank you,
All right.
Ms. Cooley.
Yep,
Dr.
absolutely.
Van
Thank you.
Deren.
Thank
Yeah.
you.
Next slide, please. So the district needs answers from us, as in the board and the superintendent, the collective we. And that goes to defining our objective. And right now, we've identified a few objectives. One is keeping children in person as long as possible. The other one is keeping that learning environment as free from barriers as possible, including masks. But the question comes up, which philosophy gives when the two collide? We may not be able to have everything we want. And here's the frustrating thing, is if we do have a mask mandate, it doesn't guarantee that we won't have to have some closure or quarantines. It reduces the number. It's an insurance policy. It's hedging our bets. So none of us have a crystal ball. So one of the questions that I think the board needs to think about, and this is an opportunity for the board without the pressure of making a decision, to talk amongst yourselves as to what direction do you want to go with this? Is a mask mandate something you want to consider? And if it is, what would be the process of making that decision? I can tell you that districts around the state are very divided on this. It's obviously it's another one of those things that's been a hot button, and I've seen everything from masks required, they tend to be larger districts, to masking for grades 6 and lower that can't get vaccinated right now, and optional for 7-12. I think the language that the board puts on the degree of masking is important. I think mask optional sends a different message than masks encouraged without, while still offering some choice. So there's that to think about. Continued COVID in sports, what does that look like? One of the things to consider is that if we do go to masks, and I'll tell you, our principals are all very divided on this too, because they want to see kids in school. Our teachers are divided. I mean, this is just a hard issue. So I lost my train of thought. I was going somewhere and I can't. So I'm going to rewind and say we have continued COVID reports, continued updates, continued local data. I think the difference between now and last year is last year we were searching for systems that with if-then statements that would trigger certain actions. And I think we've all come to the point at the end of last year that we know enough about COVID that we need to come back, that having the human factor in that decision is important, and that the data from that isn't specifically local doesn't always help us. I know where I was going. Monroe County Health Department, if we do require masks, we get additional authority from the Monroe County Health Department for contact tracing. And what that means is that if we do any contact tracing in-house, Monroe County Health doesn't have to duplicate it. Right now, anything we do in-house has to be duplicated. So the accuracy of the internal numbers, our turnaround time, our quarantine time can be quicker if we're masking. But then, that many would argue that that's a barrier to have those masks. And so I don't know that there's a right or wrong. I may not say that if I knew somebody who had passed from COVID. I've just seen a lot of changes. So my thinking for this has changes day to day. And I talked to the superintendent in Toma for quite some time this morning, and he's waiting till next week because we're at that stage of transmission where we know very well where it could go, but it hasn't quite gotten there yet. And kind of the writing's on the wall, but we're not quite there yet. So do we wait? Do we message it out to families now? What I left on your table here is it's a draft communication that is just a very honest statement about what we are doing and what we aren't doing. Because the bottom line is we have big three, we have other things too, but the big three mitigations are masking, distancing, and hand sanitizing. And when we don't do the masking, we compromise the distancing, the effectiveness, and we compromise the effectiveness of everything else. And that's the one that's so difficult. So I was thinking about that watch and warning system. I think tonight is too soon to make a decision. And I think we've got people in our community and on our board that run the gamut of ideas about this, and all of those ideas are valid. And I think this is a chance for the board to have their conversation and help me get some direction about where we want to be on the preventative versus responsive curriculum or continuum. So we could do a watch and we could look for things to get where a closure is imminent, and then come back and say, do we mask now? Or is that there's people that are going to tell you that's too late. So I am open to some guidance and some conversation to get a sense of the best way to move forward, because families want to know how to plan too. And one other piece of this with SVLA, our virtual learning, is that SVLA is a commitment for at least a semester. It's not, I can go in these weeks and then out these weeks. It's staffed on its own thing. If we need to quarantine a class or a school or multiple schools, whatever, then all of the teachers that are teaching in person will flip to teaching virtually, because our staff has all been trained in how to do that and practiced in how to do that. And I anticipate that whatever direction we go, any closures would be for the minimum amount of time, whether it's that 14 days for quarantine. But I so am hoping we're not having a discussion about a situation like we had last year.
So with that, who wants to be the individual to break the ice?
I will.
Go ahead, Ms. Presswood.
Thank you. So after hearing what you've had to present here, and you said that you've had initial talks with Toma, I feel that we play it week to week, pending CDC guidelines and Monroe County Health Department. I don't think that we are in a position to make a decision right now at this time. I mean, we're still 3 weeks out from the start of school. Many things, there are many factors. There's still many balls up in the air. I think that we sit tight and we wait and see what happens. And if we have to call a special meeting, we call a special meeting, whatever we need to do. But I think we're too early yet to make any decisions that will that will be pending the whole school year. And I don't know, my kids are happy without their masks on, and we're still washing our hands, we're still doing the things that we do, but as I'm sure lots of students are, and I know emails or people want masks, people don't want masks. So I think that we just need to sit tight right now at this moment in time and wait.
Mr. Lyden?
Go ahead, Nancy.
I guess I just pose the question, what guidance are we going to follow when we do make a decision? Because as of now, we know what the CDC guidance is, we know what the DHS guidance is, we know what Monroe County guidance is. So I guess to this point, we've just pretty much gone our own way. And if that's what we're going to do, I guess that's just something to think about. You know,
But wasn't it just reported that Monroe County is following CDC? So they're kind of one and the same almost?
that could be. The other thing I guess I'd say is that Sparta, in the information that was just shown, is still extremely low in vaccination and extremely high in transmission. So, you know, again, I think this is putting the board in a really tough position.
Right, which I go back to what I said. I don't want us to jump the gun just yet. I want us to sit and wait and see what happens over the next week or even 2 weeks when we go to full board and see where those numbers are and see what's happening and kind of make a decision if we have to at that time.
I will say that I hear from parents on both sides, and it's hard when, as you said, you know, my kids are happy without the mask. They're being kids. That's what we want for all of our kids. It's in many ways harder for me to have to say to a parent who asks me, are you following CDC, DHS, Monroe County Health guidelines to keep our children safe in school? And I have to tell them, no, not to the fullest extent. And that's not what we've been about.
Mr. Burns Gilbert.
So I just have 5 points. I'll keep it to 5 for discussion consideration. So point 1, I think I believe these mitigations we take toward the public health, community health, the safety should be likened more to safety measures. So thinking of this driving a car, right? Seatbelt is a tool to prevent unnecessary traffic fatalities, but not 100% of them. Sure, there are studies that highlight seatbelt deaths and issues during testing, reactions to taking away the freedoms by enforcing seatbelts, but seatbelts are one tool that we have to protect us, like masks, like mitigations, like everything that Ms. Kulig just went through. We also have driver's education programs, licensing requirements, updates, airbags, traffic laws, police officers, hazard lights, expectations for driving in inclement weather. And so I just ask, why aren't masks, vaccines, some of those other mitigations simply tools to help us be safer, not guarantee anything 100% during a dangerous time that could impact innocent people around us in our community, our students, our employees, and beyond. Point 2, if our general community isn't doing their part to protect others with the evidence by the barely 40% fully vaccination rate, we need to do more. I feel like as a district, we need to do more than average or more than baseline to help keep our students and staff safe. I think waiting until we're at that point of closing down a building, like the watch and warning system, before doing a mask mandate or something like that in place seems too reactionary at this point, because at that point, we're already headed too far in the wrong direction to integrate something that, right, is more so just putting a Band-Aid on a gushing waterfall or something. So And I think we're too far down that wrong direction if we wait to avoid some of those large scale learning interruptions like the hybrid and virtual shifts that everybody wants to stay away from. Point 3, just emphasizing again, CDC, DHS, Monroe County all recommend masks, and anything other than that is going against their guidance, directives. Point 4, I just want to name how ridiculous the level of politics are surrounding this whole issue. Like I said before, I think, I don't remember when it was, June, there's millions of dollars of industry going into COVID and vaccine disinformation right now. And we're seeing it in full force at leadership at all levels, right? State, federal, local, across the board. And I think the unchecked, corrupt social media, the news, we're seeing it because 99% of the current cases are from people that are not vaccinated. Arkansas had, I think, 8 hospital beds left, and they took away their mask mandate in like March, right around when Texas, Florida did, right? So like we're watching it play out. And what happened last year or earlier, right? Those other states that made action sooner got worse before we did. So that's another point I wanted to make. And then lastly, I'll end with this last weekend on Saturday, my family, we buried Aunt Joanne, and she died from COVID. And I don't want us to take the chance any more than we have to wait for more of our community to have to experience that, because just because it hasn't affected Sparta yet, in the same ways it's affected other places around the country, around the world, right? Again, it's not just a localized issue. It doesn't mean it can't or won't. So those are 5 points I just wanted to bring up. And I think I agree right now with what Ms. Presswood said about, I think it's too early to make a decision tonight, right? Which is why we're just having discussion. Because even just looking at those data points that were provided to us, the last 3 weeks, the weekly case rate went from 17 to 75 in 3 weeks. And we're 3 weeks away from now, right, to the start of the school year. And so everything could change in that time frame. So I'd be on board with going that special meeting route, recognizing that this is something that we'll need to prioritize when the time comes up. So that's all I have to say about that right now. Thank you for listening to my TED Talk. Yeah, I appreciate it. This is hard stuff.
I would
Go ahead,
ask
Nancy.
that we remind our observers that respect is due all the board members.
Just, can we have folks out in the audience, just keep it quiet to the best you can, guys. Who's ever next?
I can go.
Mr. Solberg?
Again, since I've said several times, this is a sensitive and difficult topic for everybody. Whether we've all been affected by COVID in some way or another. I believe we as people have gone through, and to a point, we've gone through everything that we are up to now. Those who want to have a vaccine have had the opportunity. The opportunity is still there any day. If you choose you want to wear a mask, that's also been your choice to protect yourself or protect those around you. I feel that adults and children have gone through the same thing here. A lot of children understand this concept, but that we would, if I had to make a decision today, I would be sitting on, we need to give choice. It is people's choice right now, looking at numbers and leaving it as a encouraged number. Looking at the numbers and like Ms. Presswood said, it's really hard to make a decision like that, seeing the trend. So I'm on board to be at a meeting at any time that we need to be to make a harder decision.
Who's next? I can go if,
I will.
okay, go ahead.
I mean, we went through this last year, and I'll be real honest with you, I think that a lot of this was overkill. And I think if we get into going with whatever the county recommends, we'll be masked up and closed in no time when these numbers start climbing. We went in January, we made a move to, and I don't remember exactly, but we became more open. And in February, we opened it up more. And the numbers at the county level, we were still in red, if I remember right. We were still in red, which would have meant they would have recommended we were closed. And we didn't go into some catastrophe. We went, did we go mask optional for the last month?
No, we had masks through to the end of the school year, and then
Or masks were optional for summer school?
the week after school
Yeah,
ended,
okay.
we went mask optional.
So for me, I'm very hesitant to sit here and take the data that these people throw out there and follow all their recommendations, because we went back to school when they were in red, and they were telling us no. To me, it's overkill. The masking thing should be optional. I wouldn't phrase it any other way. Optional or encourage, I mean, it's optional. Can or can't. That's where I'm at on it.
I'll go next. When it comes to masking, if we as a board get to the point where we're going to look at masks, unless it excludes sports or outdoors, I'm never going to be for it. So that is my hard no. Especially with the weather we have right now with that humidity level out there. I can't imagine kids trying to do stuff out there. I'm not wearing a mask and I'm dying. So that one is an absolute no-go. The furthest I could see that I might go is that 6th grade and lower that you had mentioned, Dr. Van Duren, would be a mask thing, at least until we can get to the point where students that are at that age group have the ability to have the vaccine, which I was really hoping it would be before school started. That obviously didn't happen. Because then, to me, this discussion would have been mute at that point. So I guess, to me, that's as far as I'll go. I'm not saying I vote for it now. I think we are still in that wait and see type of mentality. I think we need to see, once we get into the school, what those case numbers look like. So just because the case numbers in the community translate one way doesn't mean they're going to translate the same within the buildings themselves. If we're not seeing that transmission within the building between students or with students where they're not getting sick, well, why would we close schools or talk about masks and all that stuff when we're not seeing the transmission of the kids getting sick? I do see the other flip side of that. When we do get to seeing those cases, it's likely too late. It's there, and we've got to live with what we did, right? That's my mentality on this. I know I really didn't give any one-way answer. I'm on the fence, I guess. The one thing I will say as a no-go is sports and outdoors. If we're going to talk masks and those are considered mandatory items, it will be a no vote, and it'll always be a no vote for me.
So this isn't about giving answers, this is about taking temperature.
Yeah.
I have a question. Is there a policy? I know when flu runs rampant or whatever, what is the percentage of students that have to be out sick before a building is closed? Or along those lines, is there a percentage out there that we use?
There's a rule of thumb of 20 to 30%.
Okay. Thank you.
Of the class?
Is that building by building or?
Building by building, it was 20%.
Go ahead, Ms.
Depends
Cooley.
on the illness.
So I actually asked Monroe County this exact question, and they, with COVID, they're not giving specific percentages. They're looking at how it's spreading within a building. So is it spreading student to student, student to staff, staff to student, what have you? And looking at that data, they'll determine if they need to look at a building closure. So they're not giving a hard and fast percentage. It's going to be looking at if and how it is spreading in a building. So it'll be all case by case, and typically if it's that type of a consideration, they will then pass it to DHS or Wisconsin Department of Health Services to determine next steps. So they're always in collaboration if that's a consideration.
With illnesses other than COVID.
I was told no hard and fast anymore.
Really? So that's even gone too,
Correct.
because that has been absenteeism rates. We start hitting that 20% and we start getting antsy, and 30%, you shut down a building like it typically had to get pretty high. And I know with COVID, we have other issues, and it's not so simple. 3 cases is not 3 cases. 3 cases, it matters whether 3 students got it separately and were in 3 different classrooms and didn't commingle with other kids versus 3 students who were at the high school and switching classes. They'll contact trace those differently. It's all about whether or not the school is determined to be a place where the disease is being transmitted. So there's more complexity to it.
Right. But as a general rule of thumb, it's the 20 to 30%. So
Other
moving
things,
forward,
not with-
right. But I mean, moving forward, we could use something similar to that if and when we do have to start making these decisions, is what I'm trying to long way get to. Just because they're not using it doesn't mean that we can't use it ourselves, right? If we so
It's
choose.
It's an apple and oranges comparison. For example, when we closed Southside, we had enough transmission and we had staffing. You know, if we can't staff it, we got to shut it down.
Right.
If we have multiple classes, if the building is going down and we can't keep up with the contact tracing and we know that that transmission is happening, the chances are pretty good that for everyone's health and safety, we'll shut it down for 14 days. And at that point, that is the latest point at which I would come to the board and have that emergency meeting. I mean, honestly, I would really like to get to the 24th. I do know, and that's part of why I had this communication, is that our families need something from us. And if our answer, and there's a lot of districts in that position to say that they haven't made a decision and they're waiting and seeing. So where this is kind of coming down is not so uncommon. But we got to get something out to the families so that they know what we're doing from the mitigation side, what we're watching, what might trigger, because we're not sure, right? A meeting, but the key with a special meeting, if we have one, and just a point of order, and I have discussed this with Mr. Leiden, if we do have a special meeting on this topic, the public comment would be part of that special meeting, is that it would have 24 hours notice and it would be messaged out to all families, because I think as we heard from the board, we have a wide range of opinions on this topic, and everybody who wants to be able to give their opinion on this topic should have the opportunity to do so. So I just want to be really transparent, because the bottom line is no matter how we do this, we're going to make a group of people in Sparta unhappy. That's how this is going to roll, which is one of the reasons we all dread doing this again, because we're going in such a positive direction and so many good things happening, and we're going to have this divisive thing happening again, which is really frustrating. But what we can do is, we're not making the sausage in the back room. We're making the sausage right here, right now. And we come back on the 24th, or if we have to come back sooner, we'll make sure that everyone knows this is what we're doing and this is what we're deciding. And we decide it, and the vote happens like it happens, and we roll with it, and we move together. And because I'll tell you, it's getting increasingly more difficult for me to watch, and I'll just say it, to watch board members get browbeat when you folks are volunteering your time and you give hours and hours and hours and you agonize over making the right decision. And every one of you does, and I've seen it. And every one of you respects the other's opinions, even when you don't agree. And at the end of the day, we in Sparta are all human beings. And if we don't move forward that way, we're not going to make it through this.
Mr. Lyden, I have a
Good.
couple of specific questions or comments, I guess.
Go ahead.
The plan mitigations, I guess I just don't want to have, I want to make sure that we're being very transparent about that as well. And from what I have read for a long time now, maybe not at the very beginning of COVID, but for a long time, the disinfection is not that great a deal. There's not really any evidence that the disease is spread from person to person. And so I'm confident about that. What I don't know about, but I would really like to have some information about, is air filtration systems. You know, everybody did these needle point additions to the HVAC at the same time. And I guess I don't know if there's any data on that at all. I'd like to hear about it.
Very good.
Go ahead, Mr. Lukasik.
You know, it was brought up by several members here. Basically, we don't trust the data that is pushed out politically, locally. You know, there's those that put their faith in one side and faith in the other side. So I'm going to look at this in a little different light. We've been down this rodeo. We got the t-shirt, and learning in this rodeo has been very, very hard for everybody in this community, let alone the board members, each and every one of us. So I'm going to look at it this way. Over a year, what did we do that works? That's what we got to look at. What works? And what extent of those mitigations that worked was impact on our goal and objective for this school district? I've heard from a lot of people about how masks are restrictive and the students don't learn well. I guess I would like to hear, does data back that up? You can't, okay. That would be a question that I'd like you to research on before and during, you know. I mean, that's imperative. The other thing, you know, I got to take my hats off to Mr. Fromm and the rest of the staff who've been dusting and cleaning and taking care of the buildings and making sure everybody is safe. It works. I mean, it works. There's been several studies done that flu was gone. It was just COVID cases that came up by wearing a mask. I'm along the lines of, you know, as you've said, is to wait and see, you know. When we started this program with this COVID, we felt as a board, and anybody can correct me on the board, that we needed structure. We needed data to go by and make a sound decision for the welfare of our school district. And that's what we did. We went with the colors. And as James went ahead and said, we broke away from that because it made sense. Hey, you know, yeah, if somebody calls the superintendent and says, are you doing everything that the CDC says? Well, we've got data that it wasn't working for us in our school district. So I say, we make an intelligent decision. We each of us think about what we're talking about and have a special meeting. But I would say wait and see. Make masks. If somebody wants to wear a mask, fine. The superintendent handed out this documentation for, to send to the parents and everything like that. I think before documentation goes out to students and their parents and everything like that, we have another chance to kick this can around and see how the board wants to do it. I'm along with Josh as far as outside classes and doing without masks. I don't particularly like them, and the data shows that, you're touching your face and you're doing everything. Mr. Fromm and staff has been cleaning everything and doing a great job. We got air filter systems in there, I think we got some time to mull this over a little bit and come to some guidance. I too would like to wait and see and have a special meeting after, going in and researching a little bit more.
Just to clarify, this message would be going out this week so that families have something to base a decision off of. We're back to that place that if you want absolute certainty, we have SVLA. And I cannot tell you how much it absolutely stinks to have to say that.
Any further discussion from the board?
This decision, I guess, Dr. Van Duren, is not a lightweight decision that I, as a member of the board, have got to make. I know that we have to send out documentation so families can prepare. But can it wait a week and we can have a special meeting?
We won't know if we know things in a week or 2 weeks. What I'd really like to do is, if we can, wait 2 weeks until the next regular board meeting, and then it flows in the scheme of things. If conditions deteriorate faster than we think, or if there's a reason to do a special meeting, then I would do that. And I just want to be clear that even though there's a division of responsibility for making decisions, that whatever the board decides, the administration supports it. And as far as masking, no masking, in good faith, do our best to make it work. Whichever way we go, we'll keep you updated as far as I'm concerned, and for what it's worth, we're in it together.
And I think that's how your communication that goes out later this week, I think that's what you should say is, mask or no mask, it's optional, it's up to you. SBLA or in person, it's up to the people. And then again, if things deteriorate quicker than what we were anticipating, then we will call that meeting and go from there. So you, in your communication, you just say what you just said.
Okay. I think that's a good plan.
Any further discussion from the board? I think overall, the consensus is wait and see.
Well, and that's all I was asking for. What I will do then, and board president, if you want to make a change to it, or board members want to contact the board president, and we'll talk about it if you want to move that meeting up. Otherwise, we will continue to wait until the August 24th full meeting. And from now until further notice, if it's all right with you, President Lyden, we will go ahead and have a COVID update at every single committee meeting and at every evening that there's any kind of a board gathering. We'll just keep updating so that we know where we are.
Sounds good.
So we are sending this out then.
Well, this is my communication. I just want to make sure it's accurate. Yes,
You want direction whether to send it out or not,
Nope,
right?
I do
You're
not.
going to.
No, I do not. Yes, I'm going to.
You're
This
going
was to let
Okay.
you know that this is what's going out to families. If you have a comment or would like to discuss it with me, you can call me in the morning and we can have that conversation. But at this point, this is to share with you, just so you know, this is what we're doing, this is what we're not doing right now, and this is how we're moving forward to continue to monitor it.
If there's no further discussion, I'll take a motion for adjournment.
Second.
We have a motion for Mr. Solberg, a second for Mr. Lukasik to adjourn. All those in favor signify by saying aye.
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 Opposed? Motion carries.